Okay, my name is Hazel Woodmansey and I'm an AUT paramedic student, my second year. Today I'm going to be doing an abdominal assessment on Josh here and just check if that's going to be alright with you, Josh. So what I'll be doing is just doing a full body assessment. I'm going to have a look around and then I'll be palpating your stomach. Is that okay?
Yep.
Yep, and could you confirm your name and your date of birth for me, please?
Josh was sent on the 22nd of November 1996.
Fantastic. Okay, so after gaining consent and I've got my correct PPE and cleaned my hands, I'm now going to do a general inspection from the end of the bed. So what I'm looking for is any clues around Josh. Is there any drains? Is there any vomit? Has he got a nasogastric tube at all? Also, I'm going to be checking his body habitus. So is he looking healthy? Is he obese? He could be cachectic, which is weakness or wasting of the body. Everything's looking good so far. Also be looking for jaundice, which can be a sign of hepatic or biliary disease, and any abdominal distension, so fluid accumulation or swelling or any organomegaly, which is enlargements of the organs. Okay, and next we'll be moving on to doing your hands. Okay, so with Josh's palms down, I'm going to be checking for hyperalbuminemia. This is white spots, and it's usually due to an injury. I'll also be checking for any iron deficiency or anemia in his hands, so the colour's looking good. If you could put your nails together, Josh, that would be great. So I'm checking for any clubbing, and because you can see the shamrock's window, that's obviously looking good. There's no clubbing there. If I get you to turn your hands over, please, Josh. Thank you. So I'm checking for any palmarrhythmia, so this is reddening of the palms, which could be an indication of chronic liver disease. I'm also going to be checking for any of the Dupuytren's contracture, which is a sign of liver cirrhosis. This is a fixed flexion of the hand, a contraction of the hand, so it can be like to the side like this, or there's a couple of other ones as well. Also, could you please put your hands up straight forwards for me like this, and palms up, that's it. And close your eyes, could you please? Fantastic. So, move this to the side so we can see. Fantastic. So there's no flapping there, no tremor, which can be a sign of hepatic encephalopathy. Also, could you put your arms out like this so I can have a look? Fantastic. Okay, so I can see there's no needle marks here, which could be a sign of him having Hep B or Hep C. There's no bruising, and there's no petechiae, which is a sign of bleeding inside. Could you lift your arms up for me, please, Josh? So I'm just going to check the axilla acanthosis nigricans, which can be darkening of the armpit. So I can see here. Thank you. Fantastic. So there's no darkening there. There's also other folds in the body that it can be found. So we're just going to check the axilla. This is a sign of obesity or endocrinopathies. That's that bit done. Okay, now I'm going to be assessing Josh's eyes and his mouth. So if you could just pull your lower eyelid down for me, Josh, that's fantastic. So we're just looking at the conjunctival pallor, and we can see it's looking good. You can check for anemia this way, so it's looking nice and pink, so perfect. So if you could look up for me as well. Fantastic. And there's no yellowing of the eyes, so no jaundice. That's fantastic. If you could open your mouth, please, and let's have a look at your tongue, and looking on top and under. And we're checking for things like angular stomatitis, glossitis and swelling, all of which can be indications of low iron or B12 deficiency. We're also checking for any mouth ulcers. These can be signs of Crohn's disease or celiac disease. So I'd just like to do some palpating of your lymph nodes, if that's okay. Is that alright for you, Josh?
Yep.
Yep, so just having a feel, see if I can feel any of the lymph nodes up. Check the other side. So this is a sign of lymphadenopathy, which can be a sign of infection or malignancy. I'm also going to be checking above the clavicle, and this is checking for Virchow's node, which can be a sign of gastric malignancy as well. Okay, so I can't feel any lumps there. That's feeling good. While I'm here, I'll also just be observing Josh and checking his chest, seeing if there's any spider nevi, so more than 5 can be a sign of chronic liver disease. Now these are little red and they do look like spider sort of things on the chest. And I'm also going to be checking for gynecomastia, and this is like more tissue in the breast area. So Josh's looking good, and any hair loss, because that can be a sign of iron deficiency and anemia. But I can't see any patches of hair loss, so everything's looking good. So now I'm just going to be checking Josh's abdomen. Are you comfortable lying down? You haven't got any pain at all?
No.
No? Okay, at first I'm just going to check, have you had any surgery at all?
No.
Can't see any scars on you, looking good. I'm checking for any distension as well, which is ascites, or organomegaly, which is the swelling of organs, and ascites is the fluid accumulation. So I can't see any of that. It's looking good. There's no masses. There's no caput medusa, which can be a sign of portal hypertension. Now this looks like big blue veins all over, so it's more obvious. It usually jumps out straight away. Checking for any stomas as well, see if there's any colostomy bags. None of them, so it's fantastic. I'd like to do a light palpation if that's all right on you, Josh. So just palpate your 9 regions, and then I'll do a deeper one. That's okay. So I'm just doing the palpations to check for any tenderness or like masses or anything like that. So I'll be watching Josh's face just to make sure in case it hurts at any time, and I'll stop. Okay. So just start off with a light palpation. Okay. Lovely. I'm just going to do a deep palpation again. So let me know if you feel any pain at all. Can't feel any masses at all. Okay. So after that, I'd just like to do a liver palpation if that's alright. So I'm going to start down here and measure this in centimetres as well. Okay, so deep breath for me, please. That's it, and that again. Another deep breath. So we note the degree of distension as well in centimetres. And again. Lovely. One more time. Okay. And I'm just going to check your spleen as well. So I'm going to do splenic palpation. Okay. So just keep breathing for me, please, Josh. You're allowed to breathe. It's okay. Okay, fantastic. That's all feeling good. I'm just going to check your kidneys, okay? So I just need to push in from behind and the top, okay? Let me know if anything hurts. Okay. Lovely. And I just want to do a palpate on your aorta, if that's okay. So just hold it now for 3 seconds. Okay, brilliant. So now I'm just going to percuss and listen to the inside of Josh. We want to be checking for the borders of the liver, so just to estimate the size of the liver. I'm also going to be assessing the spleen, see if there's any splenomegaly, which is the enlargement of the spleen. And also for the bladder, I want to check any bladder distension at all like that. And then lastly, what I'll do is I'll listen across, and I want to listen to the fluid. And I'll be checking on the side here and get Josh to roll into his side and hold it for 10 seconds and then check again to see if there's any fluid accumulation or if it's now resonant again. Okey-doke. Right. Let me know if you're any uncomfortable at all. Okay, if you could roll on your side, please, Josh. Fantastic. I'm just waiting for 10 seconds. Okay, so I can hear that it's now resonant again, which is good. Fantastic. So now I'm going to be auscultating Josh's bowels, and I'll be listening for any gurgling. Gurgling is a good sound. Any tinkling or absence is not a good sign, so crossed not for that. I'll also be listening out for any aortic or renal bruits, and these are like listening to the vascular turbulence. So just give you... Okay. good. Just checking aortic. Okay, so I can't hear any vascular turbulence in there, so everything sounds good, and you've got some good gurgling going on as well. Okay, so that's us done for today. Thank you, Josh, for letting me do that on you. You can put your shirt back on now if you like. So to summarise, Joshua Singleton, and he is 20 years old. He's a male, and there's no peripheral stigmata or geopathology. The abdomen is soft and non-tender. There's no organomegaly, so there's no enlargement of the organs, and it's consistent with a normal GI examination. So to complete the examination, if I was going to go any further, I'd also examine any external genitalia. I'll also be assessing any hernial orifices, and also be doing a rectal exam. But lucky for Josh today, we will not be doing that. With an abdominal assessment, there's also some certain red flags and things like that, just to check whether it's a low acuity patient or a high acuity, whether they need to go to hospital straight away. St. John have their own red flags. These are things like severe pain, so does it hurt more when they move as well? Have they got any abdominal tenderness at all? If they've got any abnormal vital signs as well, or pain radiating to the back, that's something to look for. Any lawn or flank pain, a temperature that could be higher than 38 degrees is a bit worrying. Any women who are between the ages of 15 to 40 and they haven't had a period for more than 4 weeks, or pregnant women, quite often they'll take straight in to get assessed, and any indigestion or repeated vomiting and things like that.
Hey Hugo, we just want to thank you for being an awesome lecturer this semester. We've really enjoyed what we've learned in pre-hospital clinical assessment.
Yeah, thank you for answering the millions and millions of annoying emails that we've sent. And Josh has grown big balls now and actually done the assessment on a female, so good learning.
Cheers.